So, this is a presentation. What is it about, you're asking? Well, it's about transient ischemic attacks. And what is the deal with transient ischemic attacks? Well, let's figure out. So, you're probably wondering, what's the difference between a transient ischemic attack and a stroke? Well, the answer is pretty simple. The duration and the damage that is caused. So, a stroke occurs over a long period of time and generally does not resolve itself without some sort of medical intervention. A transient ischemic attack is typically a few minutes to a few hours and much shorter than a stroke, and it typically does not cause lasting brain damage. So now that we have that out of the way, what exactly is a transient ischemic attack? Well, they're also known as mini strokes, and they come about from a temporary disruption of blood supply to the brain. This disruption is usually the result of a cholesterol-laden fatty deposit known as a plaque lodging itself within an artery of the brain. It acts the same way that a beaver's dam acts, slowing or completely blocking the flow of water, or blood in this case, through the channel of the artery. So, there are a couple different kinds of transient ischemic attacks, and they're very complicated when you get down to the nitty-gritty science of it all. So without going into too much detail, I'm going to try to summarize this as quickly as I can. So the first kind is a thrombolytic-like stroke or transient ischemic attack. This happens when LDL, a carrier protein that carries cholesterol from the liver throughout the body to assist in cellular repair and hormone production, it is typically released when there is damage to the wall of an artery, and LDL becomes oxidized and then migrates to the site of that damage to deposit cholesterol on site. Now, macrophages, part of our immune system, they metabolize that cholesterol by breaking it down into smaller lipids, and if there's too much cholesterol, that macrophage can develop into something called a foam cell. Foam cell is a macrophage that has lost its functionality because it got too much fat. It is a fat cell that can't do anything. And when these things start to accumulate, a plaque is formed, and that can lead to atherosclerosis. And if that plaque becomes too big, it can also interrupt blood flow to the brain. The next is exactly the same, except a portion of this plaque has broken off and has lodged itself somewhere in our brain and has interrupted blood flow. So it's like thrombolytic-like, except with extra steps. So as far as signs and symptoms are concerned, we can break them down with the acronym B-FAST. So B standing for balance loss, E for eyes, blurred vision, F for face drooping, A for arm weakness, S for speech difficulty, and T for time to call 911. So there's a standard flow for the treatment of strokes and transient ischemic attacks, and it goes as follows. You find immediate medical attention, that means calling 911. Then the individual is placed on some form of antiplatelet therapy. They can be given aspirin, which is a blood thinner and an anticoagulant. They can then be sent for diagnostic imaging. And for a first-time attack, the individual is usually monitored for a period of 24 to 48 hours, and that can potentially be hospitalization. There's also the potential for long-term antiplatelet therapy, and there will be many, many follow-up appointments. What are we meant to do about this as massage therapists? Well, massage therapists will typically not see clients until they are well into the rehabilitation process and are more or less managing their own care independently. Best practice is to consult with the individual's healthcare practitioner to determine the best course of action, what should and shouldn't be done as a part of their treatment. Because strokes are so often the result of other pathologies like high blood pressure, atherosclerosis, smoking, diabetes, sleep apnea, and cardiovascular disease, specific modifications must also take into consideration these other co-conditions. In general, we're looking at short treatments of 30 to 45 minutes. We do lymphatic drainage to reduce edema. We're doing passive range of motion for maintaining joint health, and overpressure stretching in that same passive method to prevent any contractures in potentially immobilized muscles. Our focus is relaxation, specifically to reduce stress and blood pressure. Whole body treatments with focus on the most relaxing structures of the body, which is very client specific, will really drive home that calming effect that massage can produce. Low legs and feet, forearms and hands, scalp, low back, and shoulders would be my focus, especially on the feet, hands, and face, as well as the scalp, because they produce the most sedating and relaxing effects. This is a breakdown of the specific techniques that I would use personally if I was treating somebody that had gone through a transient ischemic attack. Stroking, effleurage, light kneading, mid-range passive range of motion, overpressor stretching, and home care, that would be gentle cardiovascular activity that I would recommend starting with very low volumes and low intensities, and then building up to as your capacity for exercise increases. Massage therapy is cutting edge and is therefore really difficult to prove for many of the potential benefits that are typically associated with it. So specifically for people who have suffered from strokes or these ischemic attacks, we have the benefit of stimulating the peripheral nervous system, which helps improve nervous function. It can improve joint mobility for joints that are unable to move without our assistance. There's decreased spasticity of affected limbs. There's improved muscle coordination, and there's the reduction of edema as well as the reduction of blood pressure. As you can imagine, strokes come with some pretty severe contraindications. Strokes themselves, so if your patient is showing those be fast signs, a massage therapy session is completely contraindicated. Typically, there's no massage for the first month following a stroke, and neck massage is avoided for the first 6 months following a stroke because pressure in and around the carotid artery can exacerbate symptoms or create the scenario for an additional stroke or transient ischemic attack. For the same reason, neck traction and joint mobilizations on that part of the vertebral column are avoided. And then, because strokes and transient ischemic attacks are likely caused by another primary pathology, any contraindication for that primary pathology should also be followed and respected during the treatment. So for the most common high blood pressure, you would avoid deep tissue, you would avoid vigorous techniques, you would avoid frictions, hot stone therapy, and depotement, as all of these things can be stimulatory to the sympathetic nervous system and can, again, create the environment for an additional attack to happen. These are my resources. Thank you for watching. Hope you guys have a great rest of your day.